that. We don't want anybody dying on the way, and that has happened.
I think everybody's done the recent EMTALA training too, right? You guys probably went through all that, and know to involve just a quick involvement of the bed placement so that there's no issues with that hospital-wide, right? So everybody knows about that. Yeah, Eric.
Dr. Sheck, you do orientation with the new residents coming on service.
Yep.
Each month.
That's right.
Wednesday.
No, it'll be the third day, the third weekday of each month. We do an orientation to the unit over on 4JC West, which provides exposure to physical therapy, occupational therapy, social work, our charge nurses, some of our nurses, so you can kind of just get a quick snippet of everyone that's over there. And the resources, as well as the pharmacist. Everyone comes and kind of gives a little bit of a presentation. You can put a name to a face of who can be resources for you when you're on our services. We do it the third weekday of each month. So if the rotation starts on a Saturday, it'll be on Monday. If it starts on a Monday, it'll be on Wednesday. So it's always the third day as long as it's a weekday. And I think it's beneficial to at least try to attend one time because there's a lot of information in there on how to function on our units. There's some basic information on order sets and how to do ordering for some of the chest pain protocols and those types of things. So it's pretty beneficial. So if you guys could come one time.
Some participation from that?
So I think there were a couple that came the first time that we sent it out, but it happens every month. So if you guys are on, it takes about 45 minutes to an hour, and it's done, and it'll happen every month.
Yeah.
So
I'll resend that out.
That'd be great. Yeah. All right. Thanks.
Thank you.
I just actually
Yes.
had a question.
Yeah.
Sorry.
Go ahead.
Something was the triaging. Like I was there on the cardiology surface for a couple of days at the night. Triaging calls. Like one of the things is rarely if there is a patient who has come back with a post-procedural, like post-CAT, they have a hematoma. Do we admit them, or like there was a big, ongoing whether they should be on a cardiology or not? But I thought we do. Is that the common thing, or we just do a chest pain admits, or how does the cardiology?
Typically post-procedure, we're going to bring those people back in, maybe for observation, but we usually do bring them back to our, if they've had a procedure, instead of leaving them in the chest pain unit.
Many of those people we'll see in the clinic, so we'll see them and get an ultrasound, especially during the day if they come back there. But at night, it's hard. And in general, if you think it's a post-procedure, something related to our procedure, we're generally going to want them on our service.
Yeah.
I mean, for pediatric cardiology,
because
so
actually both of us were on and we had an issue. A patient
specifically with our service. Okay.
No, it's like general, because just trying to get
Gotcha.
an idea.
Gotcha.
Obviously, we are triaging, and
Please.
in medicine or cardiology, it can come.
Mm-hmm.
There was a 25-year-old female. She had congenital heart disease, so she was being followed by pediatric cardiology. So they did a cath, and then she had a hematoma, possibly retarded bleed. She was brought back to the hospital, and pediatric cardiology couldn't take her because she's 25 years old.
So we have a deal with them. They're adults. We'll take care of them.
Yeah.
So that was the thing actually.
Yeah.
So
Yep.
that patient ended up on general medicine.
Yeah. So those folks we will bring onto our service, and we'll involve the pediatric cardiologist as needed.
They'll consult. So we're happy to bring. We're happy to
So
take those
cardiovascular.
Yeah. Especially post-procedure, cardiac procedure, we want those on our services.
Pediatricians here don't like to give up their patients. You'll see some very big children in their clinics, believe me.
Right.
But this sort of thing, we will have to be happy
Yeah,
to
and
take such patients.
the other issue is if you ever have a question at night, there's always people that are on call from a cardiology perspective. There's a staff cardiologist on the consult service 24 hours a day. You can ask them specific questions. There's a staff cardiologist covering the ADS service. There's a staff cardiologist in the CVICU, staff cardiologist on the cardiomyopathy service, and there's cardiology fellows around here all over. So feel free to contact, whomever you think is appropriate to help you if you have a question about where someone should go, what you should do with them, and that type of thing. Don't be hesitant about calling us.
Confusion arises whether patient should go to cardiovascular service or general medicine service.
Right, and I think sometimes the it's a little unclear, and that's why I think it's helpful from the standpoint of you guys if it's not post procedure and they're deemed to be sort of low risk and has other things that you think could be going on from an internal medicine standpoint. If you feel that it's appropriate, that's okay. By and large, we typically just have been admitting the patients to our services.
And then offer up The consult service will come by and see the patient.
Absolutely.
They can do it that night. They can do it in the morning, depending on
That's
how
right.
acute it is. And there's a good chance for communication. So all that requires at the end of the shift, for example, is a heads up to the consult fellow that this patient went to
Right.
med and needs consult today.
So-
And so we're happy to do that too.
Right, because you guys probably know your level of comfort of caring for a patient, right? 25-year-old female comes in and has chest pain, that's probably somebody that could go to a general medicine service and be ruled out comfortably, right? 70-year-old person with chest pain that won't go away, probably not a good place for them, right? So that's why your expertise is helpful too. You can help us to, recognize what's too much for an internist and what's reasonable. So, and our consult service can always go see someone in general medicine. So, but like I said, if you have questions at night or concerns or issues, there's a myriad of cardiologists that are a pager away. There's all kinds of us on call at night. So, and the fellows are usually around, especially the CVICU fellows. They typically spend the night here or readily available if you need a quick question or something like that. There's also a general fellow on call at night as well. So there's a lot of cardiologists running around here. All right, guys?